Hello, my name's Megan. I'm one of the enablers here at Birmingham Museum and Art Gallery, and today I'd like to introduce you to a piece here on the history of Birmingham Gallery, and it's the Apothecary's Chest. The Apothecary's Chest would have been something that was known to everybody back in the 17th, 18th and even 19th century, sometimes even into the 20th century in rural areas. It's something that the apothecary, the forerunner of modern day pharmacists, would have carried with them everywhere, and sometimes a doctor would carry one with them as well, because it contained their essential ingredients. They didn't have the modern day medicines or drugs that we have today, the pharmaceuticals, but they would have had the contents of this apothecary's chest. It would have included all sorts of things from herbs, spices, powders, even poisonous things like arsenic and strychnine that we now associate with being rat poison, were used as medicines and would have been kept safely in this apothecary's chest. I also have a little bit of a confession to make. In a former previous career, I was actually a pharmacist, so I have a vested interest in this piece in particular. It's something that the apothecary would have carried with them at all times in every visit, and it would have been largely home visits the apothecaries were doing. They would have attempted to diagnose, or the diagnosis would have been done by a doctor, and then they would make up the medicines. So they would have all of the equipment in this apothecary's chest to make up those medicines. So things like a mortar and pestle and the little tiny scales that we can see in front of the apothecary's chest would have been theirs to carry around and use every single day. None of the nice clean tablets or capsules or liquid medicines that we have today. They would have made powders up and wrapped those up very, very neatly, like doing origami, in little tiny pieces of paper. And the patient would be given instructions as how many to take and how often. This usually meant that they were taking them by mouth, but sometimes it meant more unusual things or things we're not used to these days. Some of these things could be poisonous, some of them could be very, very smelly, and some of them could actually be downright dangerous. But it was the best that they could do at the time. It was the healthcare of the time. Well, this is a very typical setup for an apothecary's chest. You can see all of the glass bottles, and probably those glass bottles would have been made in the Stourbridge, Dudley area from here, and the wooden box itself would probably have been made locally as well. And in this lovely edition, we've got the addition of ebony handles on little drawers that you can see there. The drawers would have kept all sorts of equipment, from things like a herbal book, right through to the papers and the little tiny knives and implements they needed to make up those particular medicines. And as you can see, the two sides open so you can easily access all of those bottles. And in some of those bottles, we can actually see residues of medicines. Now in these bottles, in this instance, we don't yet know what's in them. It could well have been aspirin that we'd recognise today. It could well have been digitalis, a heart medicine that we still use today. Or it could even be one of our strong painkillers, something like opium or morphine. I would love to know much, much more about that.